It's okay to feel what you feel.
The front line of this crisis is often a phone call. At centers like this one outside Kampala, telecounseling provides a lifeline, offering a remote talk therapy to thousands who would have otherwise have no access to care. Counselors say the demand is immense, but stigma keeps many suffering in silence.
If I'm leading the conversation and then I open up that I have a mental health problem, in the process, people open up. And then someone will tell you, or sometimes in the beginning, someone tells you that I have a relative, and then when you go deeper into the conversation, then someone discloses that, no, actually it's me. Because now you're trying to, is trying to overcome the stigma. Those societal barriers that where you would pay a heavy price by just disclosing.
The crisis is now creeping into schools. Authorities are alarmed by reports of attempted suicides linked to depression and substance abuse as children gain access to drugs through undisclosed channels. In response, mental health organizations are launching campaigns to educate students.
We've started debating clubs in schools to encourage children to have open conversations about mental health conditions, mental health problems, but also talking compounds, provided safe spaces. If I'm not feeling well, where could I go and talk to someone, or just sit and relax and reflect? Initial results have shown that this has been very useful.
Behind these community efforts is a health system pushed to the brink. Uganda's only national psychiatric hospital, Butabika, is dangerously over capacity. With just a handful of psychiatrists for the entire population, young people facing immense societal pressures are left without access to critical, life-saving talk therapy.
It depends on how your child was brought up when they were growing up. If she's brought up and she's assertive and she knows why she went to school and she's mature enough to know that she shouldn't adopt another person's ways, should always do what her parents told her to do, then there's no way they are going to abuse drugs and alcohol. But the majority of their youth are not well parented.
The health ministry is now scrambling to respond, working to train teachers in basic mental health first aid. The goal is to create a network of support, hoping that increased talk therapy will encourage more people to break their silence, change unhealthy habits, and find a path towards well-being. But for a nation grappling with a legacy of trauma and a surge in substance abuse, the need is vast and the resources are desperately thin. Isabel Nakiria, CGTN Kampala.